There's different kinds of filler that I'm sure we'll get into, but one of the more common types is created with hyaluronic acid, which is a natural building block, a protein that we have in the skin. Because, as I mentioned, filler does have particular risks, especially in certain areas of the face. Yes, it's true that certain fillers, of course, last a little bit longer, but more important is the individual person and then which area it's injected and how often it's moving. I will often combine filler, maybe a hyaluronic acid or a Sculptra, with some kind of skin tightening device. Maybe the day after, just be mindful of exercise if you can decrease it a touch, just because if you increase your blood pressure, there's more blood flow, there's higher risk of bruising.
Welcome to Derm-It Trotter. Don't swear about skincare, where host Dr. Shannon C. Trotter, a board-certified dermatologist, sits down with fellow dermatologists and skincare experts to separate fact from fiction and simplify skincare. Let's get started.
Welcome to the Derm-It Trotter Don't Swear About Skincare podcast. This is an exciting episode today. We've got Dr. Lisa Akintilo, and she's on the episode of what everyone wants to hear about, fillers. Now, she's a board-certified dermatologist and fellowship-trained cosmetic dermatologic surgeon at New York University, NYU Langone. She's dedicated to helping her patients look and feel their best, and she's going to help us feel our best today as we dive into fillers. Welcome to the podcast, Lisa. It's great to have you here.
Thank you so much for having me. I'm excited.
Well, I know this is something you're passionate about because you really want to give people, I think their life back. And you do this in so many ways, especially with your dedication to cosmetics and your patients. And fillers are kind of a tricky topic. It's one of the reasons I wanted to invite you on because I get a lot of questions from patients surrounding filler and just why would even somebody think about getting filler? So I wanted to have you kind of go through, who would be a good candidate? Why would somebody even get it? And then maybe somebody that's not such a good candidate as well.
Of course, it's a very common question I get in my practice. Am I a candidate for filler? I'd like filler here. And it's interesting, more times than not, I actually think they are not a candidate because there's some confusion with the term filler. Filler has become kind of a catch-all term for cosmetic procedures, often specifically to the face. And in some instances, I believe patients are more referring to something that could be treated with other procedures or other injectables. So it's a fun conversation to have with my patients. So taking a step back globally, who's a good candidate for filler? I would say anyone who is dealing with an area of what we call loss of volume or skin laxity. So that means if there's areas, and this is specific to the face, of course, you can do filler in the body too. But for the face, if there's areas that don't look as plump as they used to, or you feel like some skin has dropped with time, as we age, there is a loss of bone. We have bony resorption in the middle of the face. Our fat pads that are naturally there start to sag and recede. Skin tissue moves, and that leads to sagging that patients usually don't love. And so those are patients that filler can be a really great option to help restore that youthfulness and that natural collagen in the skin. Other patients who might be candidates for filler also may not be older patients. They might be quite young, but maybe they just wanted to enhance a particular aspect of their face. So a common example I give my patients is lip filler. I have patients getting lip filler of all ages. The younger patients usually just want a little bit more volume. They want to have their lipstick, their lip product stay on a little bit better. My older patients maybe are bothered by fine lines that are appearing on the skin, and filler is a really nice treatment option for those patients too.
So do you ever, if somebody comes in and says, hey, I want filler, is there somebody you're like, I don't know if you would make such a great filler candidate? Is it really just about what they're trying to fix sometimes that you're like, filler isn't the right answer for you?
Excellent question. So yes, that happens all the time in my practice. I'll have patients come in who say, I'm bothered by maybe lines on the lower face that are activated by movement. And oftentimes I tell patients, actually filler is not going to do much for that. Filler is more of restoring volume, like I said, helping smooth out lines, but not so much lines activated by muscle movement. So that's something that we tend to reach more for what we call our neuromodulators or our toxins. So a lot of people listening might have heard of things like Botox or Dysport or Jeuveau or Xeomin. Those are better options for those patients, especially too in the upper face. Sometimes I'll have patients say, oh, I don't like these lines. I think I need filler. Ooh, that's a different thing that can be done, but for different reasons. I think neuromodulators and the toxins are a better option there. But if someone comes in, they're worried about sagging, there's a word that I hear in the community called jowling. I don't love to use it myself. It makes me think of my dogs, but sagging of the lower face, that oftentimes filler is a nice adjunct to kind of pull the tissue back and help restore youthfulness to the skin and to the person's face, which restores a lot of confidence and is really fun to do too.
Well, I'm one of those people that's kind of a little scared of filler. Maybe I need to travel to see New York. I've been thinking about doing it in my lips for I have the upper lip that disappears a little bit when I smile. Never had a real full
Uh-huh.
lip. So I may just have to make the trip. We'll have to like film this. Have you like give me a little, like break me in a little bit, make me comfortable with it. Cause it is kind of a scary concept, I think, for a lot of patients, right? They're like, oh gosh, you're going to put something into my skin. And I
Mm-hmm.
think nowadays too, it's becoming more popular. As you probably actually have patients coming out. I'm assuming with the GLP-1 craze, getting more filler. Is
Yes.
that true too?
Yes, absolutely. That is 100% the case. When patients are on these medications for, whatever reason, they tend to lose a lot of that natural fat and collagen in the skin too. And so filler is a really nice way to help restore that. One common concern you actually did bring up, which I'm happy to address, is people are worried about filler because it's foreign and
Mm-hmm.
because they don't want to look not like themselves. They don't want a lot of product. So I like to alleviate that concern by saying, number one, there's different kinds of filler that I'm sure we'll get into, but one of the more common types is created with hyaluronic acid, which is a natural building block, a protein that we have in the skin. We just found a way to inject it from an external source into the body. The body naturally degrades it over time. It's not seen as a foreign substance. So it's really nice and natural in that way. The other thing I like to reassure patients with is that we inject tiny, tiny aliquots, tiny little bits of filler into the body. So we're not injecting huge, giant syringes into the lips and creating duck lips that where our patient didn't have that before. The amount in a syringe is actually the size of a teaspoon. So if you kind of keep that in mind, it's really just tiny little bits that are appropriately placed to manipulate the tissue and move things and adjust things so that patients are happy with the new appearance and the kind of youthfulness, as I said, of the skin.
So you talked about that hyaluronic acid, which I think probably a lot of people are familiar with because obviously very popular in forms with, as a serum or maybe included with their moisturizer. So hyaluronic acid might be something that people have a little bit of an understanding about. Do you mind talking more about the other types of filler that are out there and sort of like comparing, contrasting? Because sure, people are like, well, which one should I get if there's multiple options? Is it really dependent upon maybe the injector and what they think is appropriate? Or as a patient, should I be looking for a particular type of filler?
Of course, yes. So there are different kinds of filler, and that's something I like to emphasize to my patients too. And what we use where depends on the patient's goals and their unique anatomy. So we talked about hyaluronic acid. Another very common type of filler I use in my practice is poly-L-lactic acid. The brand name is Sculptra. And I like to call this filler actually not so much of a filler, but it's kind of just collagen fertilizer. We inject this protein or this powder, I should say, into the skin, and it stimulates the body to create its own collagen. So instead of injecting that protein building block, we're telling the skin, hey, these are the building blocks, go ahead and build your own collagen in this area that we're putting this Sculptra. And that's really nice for patients who have lost volume, maybe in the temples. They want to restore volume in the mid face. I love it for my GLP-1 patients who have lost a lot of volume, or people who are very physically active, my marathon runners who feel like their face is sagging in ways that it hadn't maybe 10, 20 years prior. Sculptra is great in that way. And I also do honestly like it for people who are new to the concept of filler because, again, it's not a foreign protein that we're injecting. We're just stimulating your body's own collagen. So patients really like it for that reason. There's another filler in the similar category called Radiesse is the brand name. Also stimulates the body's own collagen. It kind of tells the body, hey, this is where we want a little bit more volume. We want a little more definition. I love this product in, for example, the lower face. I love it when you mix it in a particular way and make it very dilute and thin. It's great for the chest to restore volume. We've used Sculptra going back in other parts of the body like the buttocks as well. So there's a lot of flexibility with these products, which is nice, and that we use certain things in certain areas. And the safety of all three of these fillers I've mentioned so far, we've had years and years of data on, and we know that they're very safe in patients. So that also helps reassure patients too, knowing that this is not something brand new. It wasn't invented yesterday or even just a couple of years ago. These have been around for decades, and they really create very natural, beautiful results.
And something else that might have been around for decades too for some of our listeners out there might be their very own fat. So I wanted to get your thoughts on, using your own fat. I remember working with a dermatologist that did a cosmetic fellowship, and they would do fat transfers, and I was fascinated by this, that we were taking
Mm-hmm.
fat out of the hip area. We were using it mostly for dorsal hand injections. I had not seen that before. It was one
Mm-hmm.
of the first times I'd
Mm-hmm.
ever seen a fat transfer. So I think some people are out there like, wait a minute, you can take some of my fat and move it around like on Play-Doh, sign me up. So I wanted I wanted to get your thoughts on, what do you think about your own fat as a filler? Is that something that's reasonable or doable? Or do you find it useful, or something that you think is not, as practical as maybe using one of the other fillers?
I love the idea of fat transfer. I do not perform it in my own practice, but I do think it's a very nice, gentle way of restoring volume to certain areas. The hands I've heard quite often people love. People also like it in certain areas of the face that might be more risky with other types of filler, particularly the hyaluronic acid. That protein that we're injecting into the skin does have some risks of just blocking blood vessels, which can lead to issues down the line with skin and with blood flow. And so if someone is really worried about that, or they are worried about volume loss in a high risk area, fat transfer is a very nice way to get around that issue. It's very easy. I think a lot of patients like the idea of it's their own body's material that's
Mm-hmm.
being injected. And so with all of that too, I think it's a really nice natural option for patients.
Yeah, I think it is attractive for people. And you're right. I don't know many people is doing it as much anymore as some of the other filler types, but I think it's just fascinating. A lot of people don't even know it's an option. So, unfortunately, if we could just do it on our own, it'd be a lot easier. Obviously, at home, we could just manipulate that. But obviously, something we need a little help with more professionally if it's a good option, for a patient. But it probably got some people excited now, and there's probably going to be a lot of people asking about
Right.
fat transfers. Exactly. So I think too, you just talked a little bit about, sort of maybe the downside of filler. People are probably curious about, so what are the side effects, or, maybe you could talk about some of the danger zones of filler where we could see more of the more serious, potential outcomes, and why you want to go to somebody who's a skilled injector.
Absolutely. And that last point, going to someone who's a skilled injector, is a huge passion of mine because, as I mentioned, filler does have particular risks, especially in certain areas of the face, especially the hyaluronic acid fillers. So those first fillers that I mentioned, it's almost like a gel that we're injecting into the skin. It's very soft and mobile. How thick that gel is depends on which filler is chosen. And we choose the thickness of the filler based on where we're putting it. So maybe in the jawline, we choose a thicker filler. The lips, we want something really mobile. We don't want bumps and nodules there. So with that in mind, when you're injecting that protein into the skin, if it gets accidentally injected into a blood vessel, that can lead to issues down the line. It can be as mild as just there's a little bit of area of skin that turns into a big bruise. Not bad. Bruises fade. That's okay. It can be annoying in the meantime, of course, but they go away. But certain areas of the face, the nose, the forehead, the area between the eyebrows, the under eyes, these are very high risk areas for blocking a very important artery that leads to the eye. And so if we block that blood vessel, it can very catastrophically lead to blindness. Now, that's incredibly rare. I don't want to worry your listeners. Filler is done many, many times every single day. It's very safe. But for that reason, you want to go to an injector who knows how to recognize the signs of this blockage of the blood vessels and knows what to do to treat it. This is not something where you go home, you aren't sure of what to do for several days before you act upon it. This is something your injector needs to act on immediately. Again, I want to reassure everyone, very safe filler, and that rarely happens, but it's good to know that those are the high risk areas as well. I like to tell my patients, I like to sleep at night. So I purposefully, personally do not inject filler in certain areas. I send to my colleagues who are very comfortable injecting in these high risk zones, the forehead, like I said, the skin between the eyebrows, the nose, and the results are beautiful. But you just want to go to someone who knows exactly what to do, where to place it, and how to recognize something has gone wrong.
What about the under eye area, that tear trough area? Because I know a lot of people come in and they obviously notice a hollowness there, or potentially, obviously, they may even have a darkening that's more linked to the shadowing, where light hits off of that sort of depression, that tear trough area. Do you feel like that's an area that can respond well to filler, or do you feel like there are better options to treat it?
I'm so glad you asked this question. Honestly, I believe most patients who come into my practice, at least I'll speak for my own experience, asking for under eye filler actually are not good candidates. And I'll
Ah.
tell you why. The
Hmm.
reason is under eye issues like
Hmm.
discoloration, like volume loss, are very tricky. And usually it's because of excess skin that's in the area or fine lines and wrinkles that are there too. And filler may help temporarily. As I mentioned at the start of our discussion, it is short lived. The body does naturally degrade it. And it doesn't do too much for discoloration or those fine lines. It really just helps with severe volume loss. So if someone has what are called bags or the swelling of the skin under the eyes, they're bothered by like excess skin there, filler in fact may not do much, and it may make things worse because it draws a lot of water naturally
Hmm.
to it, and so it may make the under eye swell even more. So for that reason, majority of patients who come to me for under eye filler, I actually refer to my plastic surgery colleagues or my oculoplastic colleagues because I think they can do some surgeries in a very beautiful way, no scar, and removing excess skin, removing fat pads that have dropped with time and leading to the end game results that the patients are looking for. I hate to have unhappy patients, and I often think that filler, if not used for the exact perfect patient, can make them sad with the results. So now that being said, there are some patients who they're great candidates for under eye filler and the results are beautiful. But I do think that's another misconception that a lot of patients think, oh, I need filler under here, when most of
Hmm.
the time it's actually more of a surgical intervention that's needed.
One thing I neglected, and I was just thinking about, as we were sitting here talking, with filler and talking about like long lasting results, as you briefly kind of commented on, just, the patients, are they happy with it? With the different types of filler, can you kind of talk about, how long they typically last? I think that's one of the concerns people have, like what kind of longevity, like how long am I going to actually get results before I might I have to refill, if you will, because the filler starts to break down over time. And I know there can be some differences, obviously, with the different types of filler.
Of course, yes. So with the latter two types of filler I mentioned, the collagen fertilizers or collagen growers, Sculptra and Radius, are the main two. Those last a long time, which patients love. So after doing a series, usually 2 or 3 times, maybe a little bit more, that lasts for about 2 years, which is great. Patients love that. They don't have to come in every few months to kind of re-up, if you will. Now, hyaluronic acid, because it's recognized by the body as a natural protein, the body does degrade it over time. And the speed of that degradation depends on the area in which it's injected. So I tell patients areas of the body that move a lot, the body tends to eat, degrade that protein faster. So lips, maybe filler lasts like closer to 3, 4 months. Whereas if you put filler maybe in the lower face or in the mid face, that can be closer to 6 to 9 months, depending on how much filler is placed and where it's placed in the person's, again, individual anatomy. If someone has a fast metabolism, again, my really active patients, the marathon runners, they tend to go through their filler quite fast, unfortunately, just because their body's kind of in overdrive with that. But yes, it's true that certain fillers, of course, last a little bit longer, but more important is the individual person and then which area it's injected and how often it's moving.
Yeah, see, there's another reason why I'm not a marathon runner. If I'm going to get filler, I got to make it.
We need it to last, yes.
Exactly, exactly. But it is kind of ironic, right? These folks that are out there being really healthy, people are, gosh, no good
Uh-huh.
deed goes unpunished, right? Out there staying healthy, running
Right.
those marathons. But you're right, I do see it in them coming in and their frustration with it, where they obviously lose some of
Hmm.
that facial volume because they are fit, but yet at the same time, they metabolize that quite quickly. So the trade
Quite
off
fast.
of good
Hmm.
health sometimes, more filler, I guess. So more filler.
More filler,
So,
yeah.
exactly. Well, as people are thinking about filler, kind of you've answered a lot of questions, given a nice overview, and kind of when people are thinking about having it done, do you find when patients come in, I know you mentioned sometimes they don't even need filler, they might benefit from another treatment. Do you find for best results, you're often combining filler with other treatments in office to give patients the results they're looking for?
Absolutely. I am a huge proponent of multiple procedures done same day for a few reasons. The biggest one being that, yes, it's true. A lot of individual patient concerns can be best addressed with different modalities of treatment. So, for example, if somebody is worried about volume loss in the mid face, their cheeks, they feel like are sagging, or their lower face, I will often combine filler, maybe a hyaluronic acid or a Sculptra, with some kind of skin tightening device. Or maybe someone is bothered bothered by the appearance of their temples, and they feel like the skin around the eye looks like there's lines there that bother them, or they just don't like the way it moves when they smile, for example, too. It's accentuated or made more prominent. So sometimes I'll combine filler maybe in the temple with toxin, like Botox as an example, just because with that combination, patients get really good results. Another common combination I do in my practice is chemical peels with filler, again, also to address both loss of volume and then skin tone and pigmentation at the same time. The nice thing is filler can be done same day with a multitude of cosmetic procedures. And a lot of patients, this is the second reason why I like to do things same day, patients don't want to keep coming back and forth. It does
Sure.
take time out of their day. They took off of work, or they're, missing their sports practice with their kids in the evening coming in to see me. And so they really want to get everything they can done safely in that same day. So some things, of course, cannot be combined, and that's fine. But we try to do as much as we can to address all of their concerns same day. And the nice thing about filler is that it typically is very safely combined with other cosmetic treatments.
So you've convinced me. I'm making the trip to New York at some point. We're gonna have to film this, because everyone, I talk about a lot that I'm a dermatologist that will recommend, and I know about a lot of procedures I've recommended for patients, but I've been too afraid sometimes to try them myself, right? But in my family, everyone tends to age a little bit more with the marionette. Like we have dimples in our chin here where we have volume loss. It's a very
Mm,
common in this lower
mhm,
area of the face. And I said, at some
mhm.
point I need to get, and I feel like I want one of the collagen fertilizers. I've done my research on this, but
Oh,
I'm gonna have
yeah.
to have you do
Good.
it to me. And then you
I would be
walk me
honored.
through. Yes, that'd be awesome. We'll have to do this. I'd love